Today, we're diving deep into a topic that affects millions of people, endometriosis. We're going to look at why the current way we handle it is, frankly, failing so many. And then we'll explore a really bold new blueprint for what true excellence in care could look like.
You know, this quote right here just hits the nail on the head. It gets to the very heart of the problem. Just imagine a system where your health, your outcome, depends more on luck, on whether you happen to find the right surgeon, than on a reliable, proven process. Well, that's the tough reality for millions, and that's exactly what needs to change.
And the scale of this is just mind-boggling. We're talking about roughly 200 million women around the globe. To give you some perspective, that's way more than the entire population of Brazil. This isn't some niche issue. It's a massive global health crisis that affects 1 in every 10 women, and for far too long, it's been hiding in plain sight.
So this is the big question, isn't it? The one we really have to ask. How on earth did we get here? Well, to figure that out, we've got to pop the hood on the current system and see exactly where and why it's breaking down.
Okay, so let's pull back that curtain. We're going to diagnose the system itself. What are the fundamental flaws that are leading to such inconsistent and, honestly, often devastating outcomes for so many patients?
The research points to 4 critical systemic flaws. I want you to think of these like the 4 wobbly legs on a table. Each one contributes to the instability and ultimately the failure of the whole structure of care.
First up, inconsistent diagnosis. Okay, imagine a surgeon trying to perform a complex operation without a map. That's pretty much what happens when there's no standardized imaging. They're essentially flying blind, trying to navigate this incredibly complex disease without a clear picture, which makes any kind of precise surgical planning almost impossible.
And of course, operating without that map leads us straight to flaw number 2, just wild surgical variability. The procedure becomes less of a planned execution and more of an on-the-spot discovery mission. And what does that lead to? Incomplete surgeries where deep disease gets left behind, and dangerous surprises that force surgeons to improvise in the moment. The third flaw, the system is reactive, not proactive. Think about it this way. Instead of having firefighters already on standby for a high-risk building, they're only called after it's already on fire. That's what's happening here. Specialists like urologists or colorectal surgeons are often brought in to manage a complication, not to prevent it from ever happening in the first place.
And finally, and this one is so important, the system just systematically ignores the patient's own experience. I'm talking about data on pain levels, on mental health, on overall quality of life. You know, the very things that determine if a treatment was actually a success. Right now, that information is just not being collected or used to make decisions.
So what happens when you combine these 4 flaws? What's the actual real-world cost? Well, these consequences aren't just abstract ideas. They are severe, they're measurable, and they are impacting millions of lives every single day. Let's take a closer look. This number is it's staggering. In centers that aren't specialized, the reoperation rate is as high as 50%. Let that sink in. That means up to half of all surgeries are failing, trapping patients in this painful, exhausting, and incredibly expensive cycle of having to do it all over again.
And this cycle of failure, it creates a whole cascade of devastating consequences. We're talking incomplete surgeries, more complications, chronic pain that never goes away, loss of fertility, and billions of dollars in wasted healthcare resources. But maybe the most damaging thing of all is that it creates this profound sense of distrust in the very system that's supposed to be helping.
But this is where the story pivots. Because, look, identifying the problem is only half the battle. Now, we get to explore the solution, a completely new vision for how we can deliver endometriosis care effectively, consistently, and for everyone.
And the most crucial part of this is a fundamental shift in thinking. Instead of relying on the skill of one individual surgeon, which is really a system of chance, we need to build a robust, reproducible process. The goal is to create a system of excellence that guarantees a high standard of care for every single patient, every single time.
And this slide just illustrates the difference perfectly. Look at the old model on the left. It's reactive, it's unpredictable. Now look at the new model on the right. It's proactive. It's built on a foundation of a proven process, shared planning, and predictable, high-quality outcomes. It's all about building a system of excellence, not just crossing your fingers and hoping for an excellent individual.
Okay, so this all sounds great in theory, but what does this new system actually look like in practice? Let's break down the blueprint for excellence and see how all these pieces come together.
Right at the very heart of this new model is the multidisciplinary team, or MDT. See, deep endometriosis is a multi-system disease, so it absolutely demands a multi-specialty solution. This isn't just a nice idea, it's a structural necessity. You have every expert you could possibly need, from colorectal surgery to mental health, all planning the patient's care together before anyone even thinks about stepping into an operating room.
This team then follows a mandatory 8-step workflow. And listen, this isn't a buffet of options to pick from. It's a required pathway that every patient follows. It starts with digital intake and collecting patient-reported data, moves through standardized imaging, and it flags high-risk cases really early on. The key here is that every single step is designed to build a complete picture before any intervention is planned. Nothing is left to chance.
So how do you actually enforce a system like this? Well, you do it with practical tools that are integrated right into the clinical workflow. Standardized templates make sure everyone is speaking the same language. A mandatory planning note documents the team's consensus-based plan. And systematic follow-ups finally start measuring what truly matters, the patient's actual quality of life after their treatment.
So when you put all of these pieces together, the expert team, the mandatory workflow, the practical tools, you're not just improving the old system. You are forging an entirely new global standard for care.
And the rewards of this kind of transformation? They're profound. We are looking at a future with drastically lower reoperation rates, far fewer complications, better long-term pain control, and preserved fertility. This isn't just about better medicine. It's about restoring patients' quality of life and rebuilding their trust in the healthcare system itself.
And ultimately, this is the entire goal: to move endometriosis care out of the realm of luck and individual heroics and into the realm of standardized, predictable, data-driven excellence for every single person.
And that leaves us with one final, crucial question to think about. This blueprint exists. The path forward is clear. So, what is it going to take from our institutions, from our providers, and from patients themselves to demand and implement this standard of care, not just in a few elite centers, but for every single person who needs it?